check out this segment from our podcast of how celebrities with migraines actually dealt with it.
Let's go on to the last subject of the day, which is actually celebrities who get migraines, which has been in the news lately.
Yep.
I actually get migraines occasionally. I get something called cluster headaches, so I'm interested to see who.
What do they feel like for you?
Well, the cluster headaches are weird. They usually don't come during REM sleep. So you go to sleep, you feel fine, you wake up in the middle of the night with a headache, and they'll usually come every day for 2 to 3 weeks, sometimes 4 weeks, when I get them. I don't get them often. I get them, I feel, when I'm sedentary, when I really haven't been doing much, maybe not sleeping as much as well, and but I may get them every 4 or 5 years, something like that. But when they come, they're a pain. It's tough to do anything when you have a migraine.
They're brutal. And the purpose of today, obviously, is not necessarily to go through the different types of migraines. There's so many. It has to do with the way the blood flow and the brain sort of relaxes and clamps down. And but there's been a lot of talk lately. Apparently, a lot of celebrities have had it made the news, so we've gotten a lot of questions on it. But you said you wanted to go through a few of the celebrities, and I can give you my thoughts on a couple of them.
I was just interested. Serena, who many consider the best tennis player ever, she suffers from migraine.
Well, I don't know Serena, personally, but from what I read, there was there's a menstrual migraine. I believe hers were of those type. It seemed to, correlate with hormone levels with her and her menstrual cycle. About 60% of women say that it gets worse with their periods and more likely to happen during those times. So sometimes just tweaking the hormones can be very helpful. So that was what I, sort of heard about her.
Ben Affleck gets migraines.
Even though women are much more likely than men, 6%, so it's a 60 and 6% rule. So 6% of men get migraines as well. So a sleep schedule is, I find, one of the most important ways to help men with migraines out and trying to get enough sleep and quality sleep, which sometimes is tough. But Rich, when you had your migraine, how did you deal with it?
The last time it happened, I kind of fought through it. The last 2 times it's happened. So we're talking about over a decade, maybe 2 or 3 times that it's happened. At the beginning, I went to a doctor, went to a neurologist to make sure everything with the brain was okay. After that, they started giving me migraine medication. Then I can't say it helped that much. What I did the last few times is I just fought through it. I started exercising in the midst of it, exercising, stretching, getting regular sleep. And I found that without medication, I was able to control them. I was also kind of more concerned of what I was eating as well. So I probably ate healthier during those times as well. But I find that the times I get it is when I'm less active. And to get rid of it, I become active. And it's not easy because these things are debilitating. And
it's everyone sort of does get to figure out what works for them. It's a variable process. Even the same types of migraines are variable in a lot of individuals. So people have to kind of learn what works for them, what doesn't. Some people like really, cold, dark rooms, the different triggers. You really do have to think through what works for each individual. I remember reading about Ben Affleck, who had them, I think, when he was, doing one of his films. It really did come down similarly just to sleep schedules. And that worked for him. I remember around the same time Lisa Kudrow. Phoebe, yeah. I don't think it was from her cat hair.
Smelly cat?
Smelly cat hair. If I remember reading about her, I think she had it as a child. So children have about a 50% chance of having migraines if one of their parents have it. So there's a strong genetic component, it appears. 75% chance if both parents have it. So knowing your family history can help and diagnose it with younger and younger people.
Marsha Cross from
Desperate Housewives.
My wife watched a lot, but not me. Desperate Housewives. She gets migraines as well.
Right. There's a lot of medications. I think she had used one of the triptan medicines, so she was one of the earlier users of that, and that is one of the ways. I'll never forget when that medication first came out. I was actually an intern in L.A., and I had an aunt visiting me from out of the country. And
When's that, about
heard about
1990?
Yeah, it was actually 1990. Okay. And I remember getting the injectable version of that medication and injecting her in between like appetizers and dinner of an important family dinner, and it just stopped her migraine completely, and she'd never had that happen before. It was the first time I'd ever injected a family member's. The whole thing was very memorable for me. Mm-hmm. But those types of medications, and there's a whole host of them now, are very useful for folks.
You're not alone if you get migraines. Janet Jackson gets them as well.
Right. She suffered from, I think, a type of vestibular migraine, which, the vestibular system is what controls your dizziness, and I think she was sort of famously getting very dizzy. Bright lights and loud sounds really trigger that, and up to 50% of all people that get migraines get really dizzy. They're treated similarly, and you want to also avoid the triggers that can make you have your migraines. So the bright lights and the sounds are often triggers for the vestibular type of migraines that she had.
Another celeb, Kristin Chenoweth. Chenoweth? Is that?
Yeah.
I'm just kidding. I'm laughing because I'm getting old here, and I don't know her quite as well as the other ones.
Right. I've seen her obviously a bunch. She was well known for having the botulism toxin called botulinum, but it's botulism, and it's a poison, but it seems to, like with Botox, work very well for migraines. So over the last decade, we've used Botox basically to inject into people to reduce their migraines. It has a lot to do with that, the vasodilation and the vasoconstriction. They are the way the arteries and veins kind of open and close and blood flow to the head. And so that seems to have been one of the things that she was well known for using for her personally.
More my age, Carly Simon.
She is, first of all, I think my favorite singer, but she was known for having it as well, and I think she's a person that became kind of a teetotaler, so she stopped having alcohol. But red wine has been a real big trigger for a lot of folks, and they don't know if it was the stuff in the red part of the wine or wine in general, but wine is a common trigger for a lot of people, including Carly Simon.
Cindy McCain.
Yeah. It's funny. I remember when she was saying it was like she said that the migraine was like torture. Didn't John McCain actually go through torture when he was in Vietnam?
Be careful using that around him.
Right. He must have been like, that's maybe not the same thing, honey, but it was really terrible for her. I remember she talked about it during the presidential campaign, and it was the bright lights that were thrust upon her at the time that actually triggered it for her.
Literally the bright lights.
Literally the bright lights. She actually started wearing sunglasses, and that can be useful for people to avoid the migraine triggers. So people know what triggers for them, and find different types of avoidance behaviors.
The next celebrity is Troy Aikman, which you would think he suffered from concussions during his career, but he actually got headaches when he was a kid, before the football.
Well, you wonder, was it before the football? I mean, he was probably playing football at the time. Wasn't he a baseball player too? I don't know if he got hit, but at the end of the day, a lot of the people that have had head injuries are at increased risk for migraines. So I don't know if he was one of those. Certainly quarterbacks take hits, and it is a concern, and why we're trying to avoid concussions as well, because that can be one of those side effects.
Elle Macpherson.
Yeah. So Elle was married to Jeff Soffer, who's not related, but shares the same name as me, sort of we see around the communities here. And Elle was one of those that was well known for using acupuncture and some of the holistic techniques that reduced stress and probably dilated up her, brain circulation, and did help her a lot. So acupuncture and things like, more holistic, methods seem to also be very helpful.
Similar, I guess, to Troy Aikman, Denver Bronco Terrell Davis, the running back for the Broncos from the late 90s. He suffers from headaches as well.
Do you remember that Super Bowl scenario?
I do remember him having a good Super Bowl. I don't remember that he left the game with a migraine, though. I've some of the guys I do. I remember Scottie Pippen leaving a game, missing. But I don't remember Terrell Davis missing a game. But apparently he did.
I don't only remember it, but I remember hearing that he got medication. And, they're so strict in the NFL on like what medications you can and cannot take. But I think he went, I don't know if it was a halftime or the quarter or sometime he got medication. I don't know what the medication was, but it cured his migraine. He went on to do great things. So finding out what works for you, what's the medication or the technique that works for you is the way to live with migraines, because we really have to live with them. They're very, very, very infrequently just cured.
Another athlete, Kareem Abdul-Jabbar, he gets headaches. He gets migraine headaches as well.
Yeah. Well, he's also sort of famous for his, embracement of all the sort of Chinese arts in particular. And, I think from him, he described it as something to do with the neck and the way that maybe his muscles were pulling on things. So I think he used also some of the holistic techniques.
It's interesting with my headaches. Mm-hmm. One thing I would do when I felt one coming on, I would literally stretch my neck for about 5 to 10 minutes. Just do all these different stretching, and often the migraine wouldn't come.
So listen, I think we can wrap up here. I think at the end of the day, celebrities are people, and they sort of exemplify what's going on. I think what we've gone through today is to show there's so many different ways. You have to know what your triggers are, know what helps you, be open-minded to holistic and traditional and even novel or new techniques that we have, which include new medications and new methods. Migraines are something that probably aren't going to be cured, but they can be really well managed. And certainly sort of we'll do more of these podcasts about the different types of migraines and what may be sort of cutting edge, and try and make it simple for everybody so that they have a good resource to sort of keep in touch with with medicine and all of the ways of treating ailments. So I think we're going to wrap up for today. I wanted to thank Richie and all of our listeners and viewers for another successful podcast of SimpleMD, where we take today's complicated medical knowledge and try and make it simple for everybody, and have a great conversation, and take your potential questions. Please submit them to info@SimpleMD. Subscribe, tell your friends about it, like us on Facebook, and we look forward to seeing you next week at SimpleMD, the podcast. Thanks so much.